Most people suspect that there may be a problem with the way that the pharmaceutical companies can influence medicine, but I think that most people are unaware of the full extent of that and the way that they really do at the moment control every aspect of medicine. So it all started really when most of the research started to be done by the drugs companies, and now I think they do something like 80% of all the research is funded by the pharmaceutical companies. And of course there's no surprise that when a company does research on its own products, it's much more likely to come out with a favourable result for the product that's being researched. And people who've looked into this have suggested that it's 5 times more likely to come out with a positive result for the product, the medication being researched, if it's done by the company that makes the product. It's not really a huge surprise. There's all kinds of problems with that. So first of all, that means that if the drugs companies are doing the majority of the research, they can control or decide what's researched and what isn't researched. They can decide what's published and what's not published. So you could have a whole list of clinical trials or data that's negative for a particular medication, but it might not be published because obviously it's not beneficial to the pharmaceutical company, or they will delay publishing it for as long as possible. And of course all that time that the results are delayed, the publication of the results is delayed, sometimes hundreds of thousands of patients or even millions of patients have continued to take that medication, and it's been doing more harm than good. And this sounds quite outrageous, but it's happened before. And one of the most notable examples would be the painkiller Vioxx. And Vioxx killed more people than people who were killed in the Vietnam War, in American soldiers. So you know, there's a lot of people who are affected by these issues. And then of course there are all kinds of problems with medical journals. And we see medical journals as this pure, pristine evidence, peer-reviewed evidence. But there are a lot of problems within medical journals. And again, one of the main problems is that the medical journal, a lot of the revenue will come from the pharmaceutical companies. So the editor of a medical journal can sometimes feel pressurized into allowing something to be published, which shouldn't really be published in that format. But he can't always challenge the people who want to publish it because he may be afraid of losing revenue from the pharmaceutical companies. And these issues have been talked about widely by the editors of medical journals themselves. So Dr. Richard Smith, who was editor of the British Medical Journal for about 25 years, he wrote a book called The Trouble with Medical Journals. And you know, it's seen as, you know, it's who is going to know about the existence of that book? Only someone who's making a documentary about this issue, or maybe a doctor who also suspects that there's issues with medical journals. But if the information contained in that book was more widely available to people, then you know, that surely would create more of a demand for change, because you have someone who is the editor-in-chief of one of the largest medical journals around the world, highlighting these fundamental problems with the way things are published at the moment. And one of the issues he highlights is this issue whereby the editor feels pressurized sometimes to publish something which shouldn't really be published. And then you have problems with the guidelines that doctors work to. So guidelines of course are issued to doctors which they have to adhere to, and if they don't adhere to those guidelines, they can actually find themselves in a disciplinary hearing. And the cholesterol lowering guidelines are a prime example. The threshold for what was called high cholesterol a few years ago used to be 6.5, so anything above 6.5 was considered high for a total cholesterol level. But then progressively, over a period of a few years, it's been lowered, and currently it's 5, and some people are talking about trying to lower it to 4.5 for some populations, for some people. And the lowering of that threshold wasn't based on any scientific evidence whatsoever. But every time you lower the threshold, immediately you have a much bigger market size for cholesterol lowering medications. And a panel of experts in America decided these new guidelines, lowering of the threshold, and 8 out of 9 of these experts on the panel had connections with the pharmaceutical companies that make statins, cholesterol lowering statins. So there's obviously a huge conflict of interest there. And although the guidelines were decided by this small group of doctors, they're followed by probably hundreds of thousands of doctors worldwide. Because within medicine you have this hierarchical system whereby, you know, the ordinary GP may not challenge the consultant, and the consultant will have an national opinion leader, and then there'll be an international opinion leader, and doctors tend to go along with what the opinion leaders and what the guidelines are dictating to them. But unfortunately, again and again, we find that the guidelines are not really based on the scientific evidence, and the counterbalance for that should be provided by, in the UK, organisations like the MHRA, who decide whether a drug can be licensed or not, and then NICE, who supposedly calculate the cost effectiveness of the medication. Well, when NICE did their calculation to work out whether statins are cost effective or not, they ignored the issue with all-cause mortality. So they only looked at the slight benefit that's seen associated with reducing cardiovascular disease. And they completely ignored the fact that even though you get a slight improvement in cardiovascular disease, you make other things worse. Overall, there's no net benefit and people don't live any longer. So they completely ignored that issue. And also they didn't incorporate the cost associated with all of the adverse effects associated with statins. And the best evidence suggests that probably about 20% of people who take statins suffer significant adverse effects. And of course, the NHS would have to, there's costs associated with dealing with many of those adverse effects, which is not incorporated into the cost-benefit equation that NICE would have used. And unfortunately, none of these organisations were willing to be interviewed when I made my documentary, because these are important questions that they should really be willing to answer. If there really is good solid evidence for cholesterol lowering, for avoiding saturated fat, for the widespread use of statins, then they should present that evidence to people rather than just decline to be interviewed.